I'm Beth Bardwell. I'm a clinical research student. I'm working with you today.
Joe Josie.
Nice to meet you, Mr. Josie. What brings you here today?
I'm having a physical today.
Okay, that's great. All right, let me start out. I'm gonna clean my hands a little bit for you. If you want to, you can have a seat. So how's your day been so far?
Fine.
It's good to hear. Got some hot weather out there. Tell me a little bit about your medical history.
I'm generally in good health. I've had 2 recent surgeries in the last few years. I had a detached retina, left eye, and rotocuff repair on my left shoulder. About a year ago exactly today.
Okay, do you have any allergies?
I'm allergic to bee sting.
Allergic to any medications?
Yes, I can't take statins. I just don't tolerate them well. That's it.
Okay, and are you on any medications?
Yes, I take Zetia for cholesterol, 10 milligrams a day.
Okay, so you have high cholesterol. Okay, very good. We're going to start out by doing your vital signs. So I'm sorry. This up here. And we're going to start out by doing your blood pressure. If you can, yeah, put your arm up here, and I'm going to pull this up. Okay, got 92/60. Does that sound like what you usually get?
Yes.
And, if you'll rest your hand back up here, we're going to do your pulse. So your pulse was 80 and respirations were 20. And are you in any pain today?
No pain at all.
That's great to hear. Now we're going to test for pupil reaction. So you can just look straight at me. Very good. And we're going to test for extraocular motion. So what I want you to do is just look at me, but then with your eyes follow my fingers. Good job. And I'm going to palpate your sinuses. So if this hurts, let me know. Does this hurt?
No.
Does that hurt?
No.
That's your frontal sinuses. Now your maxillary sinuses. Does that hurt? Does that hurt?
No.
And I need to through. So if you'll just open, okay, now say ah, okay. Or if pharynx looks good, buccal mucosa looks good, and if you'll take your tongue and touch the top of your mouth, teeth look good, the gums look good, okay, and everything looks great, thank you. And I'm gonna examine your ears next. So I'm inspecting and palpating the auricle, the tragus, and the mastoid. Looking inside the ear. And I see the tympanic membrane. Everything looks good. This here. Tympanic membrane looks good. And now I'm going to examine the cervical glands. So this is basically just feeling your lymph nodes. So these are the pre-auricular lymph nodes, the post-auricular lymph nodes, the tonsillar, submandibular, segmental, anterior cervical, posterior cervical, supraclavicular. Very good. Everything looks good. No swelling. And now to examine your thyroid, I need to, if you can sit right here for a second, I think it'll be behind you. Okay, now swallow. Very good. Next, I'm going to auscultate your lungs. So this is just checking for breathing sounds. And yeah, I just need you to lean forward a little bit. Okay, I want you to breathe through your mouth and take a deep breath in and then breathe out when I say so. Okay, breathe in. Breathe out. Breathe in. Breathe out. In. Out. In. Out. In. Out. In. Out. In. Out. In. Out. Again. Again. Okay. Again. Very good. That's good. And now I'm going to listen to your heart sounds. Listening to the aortic valve, the pulmonary valve, the tricuspid valve, and the mitral valve. Sounds good. Back on. abdominal exam. So if I can get you to lay down on the couch. And do you mind if I lift this up just a little? So I'm gonna palpate, and it's gonna be, just tell me if there's any sensitivity or pain. Any pain?
The pain?
Excellent. So the abdominal exam. Okay, so next we're gonna do the musculoskeletal exam. It's just a 2-minute exam, so if you'll stand up. Okay, and do you mind if we take this off just so I can assess? I need to look for symmetry. Okay, all right, so the first one is neck range of motion. If you will take your chin and touch your chest, look back up, look to the ceiling, look back at me. Okay, now look to your left, turn your head and look to the right. Okay, now take your right ear and move it towards your shoulder. Take your left ear, good, move it towards your shoulder. Excellent. The next part is working with your shoulders. So the first part is a resisted shoulder shrug. I just want you to push up against my hands. Very good. Now this is shoulder abduction. Put your hands like this. All right, don't let me push you down. Very good. Okay, we're gonna do shoulder rotation. So what I need you to do is take your hands and put them behind your head like you're leaning back in a beach chair. Very good. Now take them and put them behind your back like you're tying an apron. Good job. The elbows are next, so I want you to put your hands out in front of you, and I want you to touch your shoulders. Great. Now with your arms out, we're going to do supination and pronation, so just take your hands and flip them down. Now flip them back up. Excellent. Okay, we're going to work on your fingers and hands. So if you'll clench your fists, spread your fingers. Good. Great. Okay, then the next, if you'll just walk over to that side of the room, just take about 5 steps in that direction. We're going to do some walking. Now turn around and come back. And coming back, I need you to do a duck walk for me if you're familiar with that. Great job. Excellent. Next part, we're testing your back, okay? So just stand beside me, and I want you to face out in that direction. And I just need you to bend down like you're touching your toes, and I'm going to feel up your spine to see that your spinal column and your vertebrae are in alignment. Excellent. Now stand up. And I want you to extend your back, so lean back. Very good. Okay, the next part is contracting your quads. So if you'll have a seat, you can sit on this chair actually, or on the couch. Either one's fine. And I need you to kick your foot out to me and bring it back. Good. Put it down. And then the other foot. Excellent. The last part is to stand again one more time. And I want you to stand on your heels. Good. Now stand on your toes. Great. Very good on the musculoskeletal exam. If you have a seat again. So the next part is a mini mental exam. So a few questions that we ask. What's your name?
Josie.
And where are we today?
We're in Apex.
And what's today's date?
It's the 27th of July, 2016.
Very good. So this is some object recognition or remembering. I'm going to tell you 3 objects. I want you to remember them and repeat them one at a time after me, and then say them all 3 together at a time 3 times. So I want you to start at 100 and subtract 7 5 times from 100 and count down.
93, 86, 79, 72.
Right. You do it one more time.
65.
And what were those 3 objects that we had?
I will take a penny.
Excellent. And what is this?
A pen.
Very good. Now repeat after me. You cannot teach an old dog new tricks.
You cannot teach an old dog new tricks.
Good. So the next part is just simple instructions. I tell you something and then I want you to basically follow the instructions that I tell you. So I want you to take this pen in your right hand, pass it to your left hand, and then hand it back to me. Excellent. Okay, so the next part of our exam is to test sensation. So I want you to close your eyes and tell me if you feel this when I touch you, okay? Can you feel this?
Yes.
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 Those are trigeminal nerve testing. Have some shoulder testing, cranial nerve.
Yes.
Can you feel this? Can you feel this?
Yes.
Now hold your hands palm up. Can you feel this?
Yes.
Can you feel this?
Yes.
Can you
Yes.
feel this? This?
Yes.
This?
Yes. Yes.
This? This?
Yes.
This?
Yes.
Okay, great. And you're gonna wash your hands. Can you feel this?
Yes.
And this?
Yes.
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 And if you'll lift your feet up. This?
Yes.
And this?
Yes.
Excellent. Great. Okay, so now the thing that we have left to do is to test your reflexes, the funnest part for last. If you would have a seat there, let's see if we can do it at this chair. Okay, so first, I'm gonna test your bicep. So just relax your arm. Now I'm gonna test your tricep. Relax your arm, just let me hold over your arm. And then your brachioradialis. Relax your arm. Okay, so to test your knees and your ankle reflexes, if you'll come over here to the table, that would be helpful. You just sit here. Very good. So that concludes the exam today and everything looks fine. You look normal. Do you have any questions?
No, I don't. Thank you.
Okay, well, you're welcome, and we'll see you again in the year.
Thank you.
Thank you. Vogel. I'm working with the clinical research team at Campbell, and we're going to do some additional abdominal exam procedures today. Okay, Mr. Josie? Okay, so I'm going to just lift your abdomen up so I can auscultate or listen to your bowel sounds. And I'm listening until I hear them, or up to 2 minutes if I don't. I'm auscultating over the aorta, the renal, and the iliac. I'm going to probably over the liver. And feel for aortic pulse. And if you'll sit up for me, Mr. Josie. Just sit up. You don't have to. Yeah. Okay, so if you'll lean forward, I'm just gonna. This is basically testing to see if there's any kidney pain. So I'm gonna put my hand here and I'm testing for CVA reaction. No pain?
No pain.
Okay. Now you can lay back down. Okay, I'm gonna percuss the liver span. Okay, so if the patient has abdominal pain, I would test for rebound tenderness. So if he has rebound tenderness, I would push in and pull out and ask, do you have pain when I pull out? And I do that in each quadrant. Do you have pain when I push in or pull out? Do you have pain when I push in or pull out? Do you have pain when I push in or pull out? Another special test is the Murphy sign, and it's in the right upper quadrant. Basically to see if there's any gallbladder tenderness. So I would like for you to take a deep breath, Mr. Josie, when I press. Inhale in and breathe out. Any pain? So I'm testing for appendicitis, and one of the tests is the McBurney's point test. Okay, tell me if you feel any tenderness or pain. All right, no pain. Okay. Now, another test for appendicitis is the iliopsoas test. So I'm going to press down. It's a resisted hip flexion test. So if you'll just push up with your leg against me. Any pain?
No.
Okay. And the obturator test, which I'm going to just let you move your leg. I'm going to bend your knee and bring it over to the side. Any pain?
No pain.
Good job. And that's it. So, Mr. Josie, we're going to do some neuro exam testing, some additional neuro exam testing today. And the first part is a cerebellar test. And part of it is for coordination. So I want you to take your finger and touch your nose and come back and touch my finger. Now touch your nose, touch my finger, touch your nose, touch my finger, touch your nose, and touch my finger, and touch your nose. That's good. The next part is rapid alternating movement testing, and it's also cerebellar testing. And if you will just put your hands in your lap and then basically flip your hands back and forth so I can see you do that. Very good. Okay, And so another part of the Small Bone test is some gait testing. If you can stand for me, please. So what I need you to do is basically just walk over to that side towards the table, and then when you come back, I want you to walk like you're walking on a tightrope. Yeah, walk normally over to the other side, and then walk like you're walking on a tightrope back. Very good. Very good. The next part of the test is the Romberg's test. So if you'll stand right here beside me, and that's right, and I want you just to close your eyes and stand. Excellent. The next part of the test is the pronator test, and I need you to put your hands out in front of you with your palms up, and close your eyes, and stand. Excellent. I'm sorry, I have one more test for coordination. And that's heel to shin. So you just take your heel and run it down the opposite shin. It's for coordination, right? Very good. Now do the other foot. Excellent. Okay. If you'll lay down, this is the Brudzinski's test. Okay, and can you slide down just like with your head flat? And I'm just going to lift your neck up. So just let me lift your neck up. And the Brudzinski's test was normal, which means that you don't have any meningeal lining or brain meningeal issues. Very good. And you can sit up now, Mr. Josie. Okay, now we're going to test your cranial nerves. So if you'll close your eyes, we're going to start out with your olfactory nerve. Tell me what you smell.
Smell coffee.
Very good. You can open your eyes. Excellent. Now we're going to test your optic nerve. We're going to do acuity, visual fields, and use a fundoscope. So today you have some issues with the detached retina. But I want you to cover your right eye and read each line as far as you can.
First line, E. Next line, FP. Next line, TOZ. Next line, LP. ED. Next line, PECRB. Next line, EDFCZP. Next line, RELOPZD.
Very good. Now cover the other eye and do the other eye, starting from the top.
Top line, E. Next line, FP. Next line, TOZ. Next line, LPED. Next line, PECRD. Next line, EDRCZP. Next line, RELOPZD.
That's good.
Next line, DEROTEC.
Very good. Okay, now just use both eyes and read as much as you can.
Top line, E. Next line, FP. Next line, TOZ. LPED. PECRD. EDRCZP. RELOPZD. DERPOTEC.
Very good. Okay, so we're gonna test your visual fields. So I'm gonna start back here and I'm gonna put my fingers out, and I want you to tell me when you see my fingers come into your field of vision, okay?
Stop. Stop. Stop.
Was it equal on both sides?
No,
Okay, which side was worse?
this side.
I'm gonna do this side again. Tell me when this comes into your field of vision.
Stop. Stop.
straight ahead. And this reflex in this eye. And so the reflex in that eye. And now for your trigeminal nerve, if you will just basically clench your teeth. Very good. And do you feel this?
Yes.
Do you feel this?
Yes.
Do you feel this?
Yes.
This?
Yes.
This?
Yes.
Feel that?
Yes.
Okay. Now, facial nerves. If you'll raise your eyebrows. Okay, lower your eyebrows. Close your eyes. Smile. You can open your eyes. Now smile. Frown. Okay, and puff up your cheeks. Very good. Okay, acoustic part of the hearing test is I'm going to do a whisper test. So I'm going to say a word very quietly on this side. I want you to tell me what this word is. Baseball.
Baseball. Football.
Very good. And this is the Weber test. So I'm going to basically put this right here, and I want you to tell me if you hear and sense it or feel it on both sides equally.
Feel it on the left side.
We're going to do the Renee test. So vibrate this and put it behind your ear, and I want you to tell me when you stop feeling it. Do you feel that? Tell me when you stop feeling it. Can you hear it?
Yes.
Okay, very good. We're going to do the other ear. Do you feel that? Can you feel it?
Yes.
Tell me when you stop feeling it.
Yes. No.
Can you hear it?
Yes.
So your Renee test was normal, and you lateralized to your left ear with the Weber test. Okay, so the next glossopharyngeal nerve, what I need you to do is just to swallow. So we can see if you swallow. Very good. And the vagus nerve is, I want you to just say, ah for me when I have my light. Okay, so open your mouth and say ah. Very good. And then the spinal accessory testing is to do a resisted shrug. So I just need you to resist my hands. Show. Very good. And now turn your head to the left and turn your head to the right. Excellent. The hypoglossal nerve, if you will stick your tongue out. And now move your tongue back and forth. Very good. Excellent. So the next part of the neuro test is the discriminative sensation. So this is going to be object recognition. If you'll open up your hand, close your eyes. Okay, you can close your hand around that. Tell me what you have.
Q-tip.
That's right. Okay. Now you can open your eyes. I'm sorry. And the next part is the graphesthenia test. So actually, if you close your eyes one more time, and I'm going to write in your hand, I want you to tell me what I'm writing.
A 0.
That's right. point discrimination, and as you can see, this paper clip has 2 points. I'm gonna use this on your hands, okay? When I touch the different parts of your hands, I want you to tell me if it's 1 point or 2 point. So close your eyes. 2 points or 1 point?
2.
2 points or 1 point?
1.
2 points or 1 point? 2 points or 1 point?
1.
2 points or 1
2.
point? 2 points or 1 point?
2.
Very good. Excellent. And you can open your eyes. Okay, so this is position and vibration, and what I'm going to do is, if you'll give me your hand, I'm going to move your thumb up and down, and I want you to close your eyes when we do this. I want you to tell me if your thumb is up or down when I finish moving it, okay?
Up.
Right.
Down.
Do this hand.
Up. Up.
Very good. Now we're going to do that with your toes. So go across your legs.
Down. Up.
Now this we're going to do vibration with that. So just keep your hands apart and relaxed. I'm going to take your fingers. Do you feel this?
Yes.
Do you feel this?
Yes.
Good job. Now we're going to do your feet. So cross your legs. Do you feel that?
Yes.
Do you feel that?
Yes.
Good job. Now we're going to do some motor strength testing. So basically it's testing you a little bit first for muscle mass. And the next part is a passive stretch. So what that means is you're just going to let me take your hand, I'm going to take your arm and lift it up, and just let me hold the weight, okay? Very good. Now we're going to do this arm. Hold the weight. Good job. Okay, so we're going to do shoulder abduction. So again, we're going to do push your fists together. Okay, don't let me push you down. Very good. Now you can release that. And now we're going to test elbow extension. All right, so wait. So okay, so I'm going to push in. Don't let me push in. Great. And don't let me pull you out. Very good. Now we're going to do wrist extension. So just put your hands out. Right now. Flex your wrist down. Don't let me pull your wrists up. Good. Okay, so very good. Now don't let me pull your wrist down. Excellent. Okay, take my fingers. Okay, you look good. That's very good. Spread your fingers out a little bit. Don't let me push your fingers in. That's good. Okay, now we're going to go down to your hips and your legs. So we're going to do hip flexion and extension. So I'm going to push down on your leg. You push up against me. Good. Now, all right, lift your leg and now push down. Very good. Push out with your leg. Now pull in. Push up with this leg. Now push down. Push out. Push in. Very good. Okay, so with your ankles, I want you to press down on my hand like you're pressing on the gas. Right. Now push up. Let's do that with your toes. Press down with your big toe. Now push up. Good. Press down on my hand like you're pushing on the gas. Now push up. Press down with your big toe. Push up. Good job. We also want to do hip adduction and adduction. So if you'll push in with your knees and push out.